Imagine Eddie. Eddie was 9 years old when he first smoked heroin. At the age of 16, he was regularly injecting heroin. By the age of 19, Eddie was out of his home. He was sleeping on the streets. He was in and out of prison, and he was sleeping in homeless hostels. Because of this, Eddie needed to inject himself wherever he could, discreetly hide himself away. So he would inject himself in parks, in public laneways, in public toilets, in prison cells, in homeless hostels. And because of this, his health deteriorated. He contracted HIV, he contracted hepatitis C, he regularly had very painful abscesses, and he had other complex health needs due to his injecting practices. By the age of 25, very sadly, Eddie passed away. Eddie had gone to a stairwell in a residential apartment block. And he had gone to the bottom of the stairwell to hide himself away and inject himself. It was when he injected himself for the last time. He died there, hunched forward at the bottom of the stairs, and he was there for 3 days until somebody found him there. A resident of the block finally found him down there. My name is Tony Duffin. I am the CEO of the Ana Liffey Drug Project, a small NGO based in Dublin. My colleagues and I have, we've known too many tragic cases like Eddie's, and we've been to too many funerals. And we want to do more about this. But street-based injecting occurs across Ireland in places like Cork City and Limerick City and Galway City and other areas. But we know that it's at its worst in our capital, Dublin, in Dublin city centre. And we know, for example, that we estimate that there are around 400 people who inject themselves in the public domain in any given month. And they would do that on multiple times. And we also know that during 2012 to 2014, 25 people who inject drugs in the public domain died in Dublin city centre. A further 18 people died in homeless hostels in the same period, people who inject drugs. So we know that it's a very difficult situation. We wanted to do more, and on 20th of January 2012, we began to lobby for a change in the law to allow for the existence of supervised injection facilities. And we succeeded. On the 16th of May 2017, the President, Michael D. Higgins, signed into law the Misuse of Drugs Supervised Injection Facilities Bill 2017. And I guess when you think about it, 6 years ago, nobody was talking about supervised injection facilities. But after 5 years, 3 months and 27 days, the Ana Liffey Drug Project had successfully lobbied for a change in the law to allow for their existence. I want to share with you 4 strategies that worked for us in terms of successfully lobbying for that change in the law. Firstly, you need to know your case. You need to know the arguments for and against supervised injection facilities. That's what we needed to know. We need to know that because we wanted to be able to bring people along with us. And we also needed to be able to respond to any counter-argument robustly. And so we got together the information that we needed. To give you an example, when we set out to do our statement of intent, as it were, we launched our strategic plan. In there, we had a goal, which was to gather stakeholder support, lobby for the change in the law, and then to deliver a supervised injection facility. And we did that, we put that out in the public domain on the 20th of January 2012. But it was contentious. And one of the people who were due to get up on the stage with me that day to launch the strategic plan couldn't bring themselves to come on the stage because of the fear of the backlash that they perceived would come afterwards. That was instructive to me. I understood that was helpful. It made me understand that we were going to need the evidence. We were going to need to be able to explain ourselves as best we could to bring people along with us. So that's what we did. We gathered the information from across the globe and the evidence from across the globe, and we put out a position paper. We put out a position paper explaining what we were trying to do and the evidence for it. And we instructed a barrister who worked for free to help us and produced a legal opinion. And I'll come back to the legal opinion in a moment. So we gathered. So we needed to know our case, and we did that. Secondly, we needed to know our stakeholders, not just who they are, but what their needs were. And we needed to speak to their self-interest. Stakeholders in this regard were health and policing, people who inject drugs, businesses, local community, etc. So to give you an example, from looking at the evidence, we were aware that when you open up a supervised injection facility in an area where street-based injecting is a problem, a significant problem, when you open one of these services, you improve the amenity of the area. That's a very important message for certain stakeholders, businesses in the city centre, people who live in the city centre. So people who visit the city centre, anybody. But particularly to speak to the stakeholders' interest, we made sure that message was going out there, and we did that. Which brings me on to messaging. The third thing we needed to do was engage with the media, and we needed to engage with the media significantly and widely, consistently. And I met with a friend of mine who, again, gave his time for free, because we're a charity. He gave his time for free, and he told me, he said, look, what you're trying to achieve, you're trying to change the law to allow people to inject themselves in a safe space with unknown or illicit drugs. So that's newsworthy, and you can make your own news. Now, to me now, it seems so obvious, but on that day, when he told me that, it was a light bulb moment, it was an aha moment. And I took that ball and I ran with it. And if you simply go online and do a search for Ana Liffey Drug Project, you will see the level of media engagement that we have over the last 4 years. So that's engage with the media. And then, fourthly, you need to reach out for help, okay? What we were doing had never been done before, and we were going to meet hurdles. And to get over those hurdles, we were going to have to be, determined, we were going to have to be problem solvers, and we were going to need help. To give you an example of that, we had realized that because of the legal opinion that I mentioned a moment ago, that we would need to change the law. We also had come to the conclusion that we needed to do a lot of the heavy lifting if we wanted to see this be successful. And what I mean by that is we wanted to draft the legislation, but we didn't have the capacity in-house, and we didn't have the expertise in-house to draft legislation. So we reached out, and we reached out to a group called the Voluntary Assistance Scheme of the Bar Council of Ireland. And we went to them and we said, would they help us? And they said they would. And they set about drafting legislation that would allow for the existence of supervised injection facilities if enacted. So they worked for free, again, for 12 months in their own time, a group of barristers who had established a small group to draft the legislation, and then they handed it over to us. Then I had another hurdle, right? We had draft legislation, robust draft legislation, but we had to get it into Parliament. It had never been done before. So we reached out again, and we reached out to the then Minister of State, Ana Liffey, who was responsible for the national drug strategy, and we asked him for his help. And he said he would help us. And he began the legislative drafting process. And he was our first political champion. And then our second political champion was his successor, Minister of State Catherine Byrne, TD, who took up the baton from Minister O'Riordan and got it through Ireland's parliamentary processes to the point where our President Michael D. Higgins enacted the legislation on the 16th of May 2017. So just to summarize it all up, in our experience and upon reflection, the strategies that worked for us were to know your case, both for and against the proposed change you want to make. Know your stakeholders, not just who they are, but what are their needs, and speak to their self-interest. Engage with the media, engage widely and regularly. And finally, reach out for help, because if you're trying to do something that's never been done before, you're definitely going to need that help. And throughout it all, do what you can and work hard to bring people along with you. Thank you.